the herbal products for healing colon inflammation. I'll share my slides now. Okay, can you see the slides?
Yes, sir. Yes, sir.
Okay.
Just highlight the slides, sir.
Yeah, sure.
Yes, sir. It's perfect.
Okay. Okay. Today's topic is about the rational use of natural products and nutritional supplements in healing colon inflammation. The contents of my today's slide is I'll be discussing about the symptoms or diseases related to colon inflammation. That is, I'll give a brief introduction to IBD, inflammatory bowel disease. Then I'll be discussing about the consequences and treatment related to IBD. Then I'll discuss about the use of natural products, the foods or the diet or nutrition which are related to heal the colon inflammation. Finally, I'll conclude with the slide. Let's start with the introduction to inflammatory bowel disease. When you talk about the colon inflammation, the most specific disease we recall is inflammatory bowel disease. So it is an umbrella term used to describe the disorders that involve chronic inflammation of the colon. There are different types of inflammatory bowel disease, like you can see about Crohn's disease, or you have ulcerative colitis. These are the most common symptoms or diseases. It is occurred under the umbrella of inflammatory bowel disease. When you talk about the Crohn's disease, so this type of IBD, it is characterized by the inflammation of lining of digestive tract, which often can involve deeper layers. And regarding ulcerative colitis, this condition involves inflammation and sores along with the superficial linings of large intestine and rectum. So this is the difference between these two diseases. One is Crohn's disease, one is ulcerative colitis. And Crohn's disease is more specific. Crohn's disease is more specific for autoimmune disease. And regarding the symptoms, so these inflammatory bowel disease symptoms, it varies. It depends upon the severity of the inflammation and where it comes. Like it can be affected from mouth to anus. Anywhere from mouth to anus, it can be affected. But the most common symptoms you can see is diarrhea, fatigue, abdominal pain and cramping, blood in the stools, reduced appetite, and unintended weight loss. So these are the very common symptoms you can see in both Crohn's disease and in ulcerative colitis. But as I said that the symptoms, it varies from person to person. It varies from mild to severe symptoms. It varies from active illness. It varies from periods of flames and remission. So all these are the different factors. Depending upon these different factors, or depending upon the severity, depending upon the person to person, they have different symptoms. The causes of inflammatory bowel disease, you can see that there are different causes. The exact cause is not known, but initially the doctors were suspected that it may be because of the diet and stress, but not solely about these two factors. Later on, they have found out that the other possible cause is immune system malfunction. So when immune system tries to fight off an invading virus or bacteria, So there may be abnormal immune responses which causes the immune system to attack the cells in the digestive tract. So our own immune response, they fight against our cells. So that's the reason that the immunity is completely collapsed, the immune system is completely collapsed, and there is a abnormal infections in the colon. So let me explain this process with a video or some any animation. So generally our body, it has a complex set of cells that protects our body from different infections, what we call as innate immunity system. So it is not enough to have give protection, it's non-specific. Then we have another type of immunity which we are adapting. 1 second, just I'm receiving one call, just 1 second, space. Sorry for the inconvenience. I'll share again the slides. So regarding our immune system, as I was telling that we have innate immunity and we have adaptive immunity which fight against the infections. So since this innate immunity, it may not be sufficient, and it is not specific for certain infections. So there's the reason we have some adaptive immunity. But in certain cases, even this adaptive immunity, it may not be sufficient for certain diseases, in certain infections. It all depends upon certain upon person to person. For example, let's assume that our body is like a bank, and there is a robbery by some foreign particles, and there will be an alarm, and they will send some specific antibodies to fight against these infections, these foreign particles. So this is a general immunity of our body, where the antibodies, they fight against the foreign particles. In IBD, like we have Crohn's disease and we have ulcerative colitis. So in this Crohn's disease or ulcerative colitis, there might be flares, there might be remission, there might be, like as I said, that sometimes the symptoms appear, sometimes the symptoms there may be vanished. And it is not similar to IBS, that what we call as irritable bowel syndrome. So it is non-inflammatory. There are several factors why we get the IBD, like genetic, childhood infections, environmental factors, sedentary lifestyle, or too much socializing nowadays because of the computer, because of the digital media. So everyone, they are prone to those factors. And in this condition, like same, come back to the our bank example. So in IBD, in autoimmune disease, so these antibodies, they are not specific and they are inefficient. They doesn't know what to do that. So they will arrest everyone that. So even the innocent customers, they will arrest them. So likewise, even the useful bacteria are controlled by our body. So here, specifically in Crohn's disease, it is affected throughout the world by like about 1.7 millions. They are affected just in Europe. And here in Crohn's disease, they have, as I told you, that it might be affected from mouth to anus, anywhere they can have some infections related to the gastritis. And they will they have some mistake identity of our own useful bacteria, and they are arrested. And that's the reason our immunity is completely collapsed. And it may be affected from the ages 15 to 30, and there are several factors. Diet is there, smoking is there, genetic factor is there, sedentary lifestyle is there, sugar substance is there. So all these are the different factors which may lead to fatigue and stress. And regarding the ulcerative colitis, again here, it is affected throughout the world. In just in Europe, 2.6 million people are suffering from ulcerative colitis. Even here in the same, there might be a mistaken identity, and our immune system is getting collapsed, and mostly it is affected in the large intestine and there might be certain mucus, there might be certain blood, there might be ulcers in the large intestine. And again, same factors are affected because of the high animal proteins, genetic factors, bacterial infections. You may get cramps, you may have fatigue, and here again there might be some sudden flare-ups of these disease in ulcerative colitis or Crohn's disease. So here with this animation, we can see that how the our immune system get collapsed because of the mistaken identity. So next, about the risk factors. There are several risk factors which are related to Crohn's disease or ulcerative colitis. Like, for example, the first one is age. The most people who develop IBD are diagnosed before 30, as I have mentioned in the animation. But some people, they don't develop the disease until 50s or 60s. So there are chances that even in 15, 60s, they may have this disease. But at young ages, starting from 15 to 30, the people are affected with these IBD. Next, about the race and ethnicity. So although whites have the highest risk of the disease because of the urbanization, because of the ultra hygienic conditions, and because of the diet what they take, that they are very much prone to this IBD, but still other races are affected. And again, family history. If any of the family members are having any gastric problems, they have any IBD, then the generation, they have the higher risk. Even the close relatives, if they have this disease, they are the relatives, they have the higher risk of having IBD. Smoking, it is another most important risk factor for gastric problems. So same with the Crohn's disease and ulcerative colitis. And also the use of non-steroidal anti-inflammatory medications, which includes ibuprofen, naproxen, diclofenac sodium. So these are some of the medication which may increase the risk of IBD, or it may worsen the disease. It may worsen the disease when they are taking NSAIDs continuously. Regarding the complications of the disease, you have several complications, and again, it depends upon person to person. So like they may have colon cancer, they have skin diseases, eye diseases, joint inflammation, they have medication side effects, they have liver sclerosis, blood clots. So all these are some of the common complications you can see in IBD. And more specific, if you say more specific for Crohn's diseases, you have bowel obstructions, and you have malnutrition, you have fistulas. So these, and anal fissure, these are the very common complications you can find in Crohn's disease. And sometimes it might be fatal because of the multiple infections. And in ulcerative colitis, it may cause toxic megacolon. So where the colon rapidly widens, it swells, and it is a serious condition. We call it as toxic megacolon. And there might be certain hole in the colon. There is a perforated colon, most commonly caused by the toxic megacolon. And then there might be a severe hydration. So excessive diarrhea, it may result in dehydration. So these are the common complications you can see in Crohn's disease and ulcerative colitis. So regarding the diagnosis and treatment, the most common diagnosis is they do the colonoscopy, they do endoscopy, they take culture test, they take culture test, or they take the stool test. So all these are some of the important diagnosis, and it is better that whenever there is any disturbance, gastric disturbance, it is better to go for colonoscopy and endoscopy. And apart from that, they also do CT scan and MRI. And regarding the treatment, they have a step up therapies. So initially, with the initial problems, initially when they have diarrhea or they have any inflammation, so with these tests, they try to start with antibiotics. They try to start with some acetyl salicylic acids, and then based on the inflammation, based on the severity, they give some steroids like prednisone or budesonide can be given, and then they give some methotrexate antibiotics or azathioprine. And then they start biological therapies. There are many biological therapies. And finally, if it is not controlled by these treatment, they may go for surgery, especially for ulcerative colitis, where they remove the infected colons. So they reduce the colon, they cut the intestine, whether it is a small intestine or large intestine. They cut the severity based on the severity. They cut the infected parts. So this is about certain treatment you can see in IBD. So these are about the allopathic treatment. But as I said, that sometimes these medication, it may increase the complication since it is an autoimmune disease. Use of biological therapy, of course, it has given promising results, but due to certain infections, so again, your immunity is completely collapsed. So there are chances of deaths. There are serious chances. There are some cases of death. And recently, I have experienced with my classmate who died because of Crohn's disease. And mostly because of this incident, I was very much interested to present this talk, so that there might be awareness in everyone, especially who are living outside, that those who are taking frozen foods, those who are taking processed foods, those who are taking fast foods. So they are very much prone to these inflammatory bowel disease. And as I said that these allopathic treatment, it doesn't have any promising results. There is no cure, but at least you can control the complications. Or as I said, there might be flares, there might be remission. So again, it may appear. So there are certain problems with these allopathic treatments. I'm not saying that you should not use it. You can continue. Along with that, you can have some complementary and alternative medicine. So you can use certain natural products. You can use certain natural remedies. You can use the nutrition. You can have some dietary approaches which are very specific for Crohn's disease or ulcerative colitis. So I like to share some of the natural remedies or natural products, or you can say nutritions or supplements, which can be used to heal this inflammation in the patient. Because mostly in our nature, there are many substances, natural substances, which can cure a lot of diseases with minimal side effects. Because of the use of allopathic treatment, you can see there might be a lot of side effects. And the treatment varies from one person to another person. It is not same, especially in autoimmune diseases. The severity is very high. The risk rates are very high. There is a reason, if we are taking natural products or natural remedies as an alternative or as a complementary therapy along with this mainstream medication, it helps a lot. I'll try to show some evidence-based information on these natural remedies or natural products or nutrition. Let's start with some very common natural remedies you can see in our household, especially for the gastric problem, is probiotics. It is very much important. Even the WHO, it has considered as a main product which can be used for IBD. So here you can see that it promotes the growth of the helpful bacteria in digestive tract. It has the ability to modulate the cytokine production. And the most common in household, you can see that you can use yogurt, and even there are many commercially available probiotics in the market. And there are some compositions, because sometimes just taking yogurt or taking buttermilk, it may not help the persons. So you have to take some special combination of these bacteria like lactobacillus rhamnosus or bifidobacterium lactis or bifidobacterium lognum. These are logum. So these are some of the bacteria which have promising results, especially in IBD. As I told you, that it has a ability to modulate the cytokine production so that it reduce the inflammation. So most important thing in IBD is that we need to bring back our natural bacteria which are useful in the intestine, in the colon. And second thing is we need some natural foods which have some anti-inflammatory properties. We need to avoid the foods which increases the inflammation. So when you take these remedies, definitely you can see there might be some reduction in the inflammation. There might be increase in the immunity. So this is about the probiotics. And next is what I have seen in the evidence-based is the bovine immunoglobulin. So when you're giving some immunoglobulins from bovine, they have seen a promising results, and even WHO, they have recognized that it belongs to a certain special purpose medical food. And if people suffering from IBD, if they take 5 grams per day for 12 weeks, it maintains healthy intestinal immune system, because it has the ability to bind to the microbes and toxins within the gut, and it forms a large complex and do not allow us to encounter with the dendritic cells. So it has an advantage, and it increases the immunity in the persons, and it brings back the natural bacteria which are helpful in the colon. So other important thing is about the use of omega-3 fatty acids. So it is very important for the health, for the heart, for the brain, as well as for the gut diseases. So here we have some polysaturated fatty acids from omega-3 substances. It keeps our immune system healthy, and it helps to lower the risk of several diseases. And generally, in infants, it plays a role in the brain development, nerve development, and eye development. The most common sources are fatty fish like salmon, mackerel, anchovies, sardines, Arctic char, and trout. These are some of the natural sources. And apart from that, you have omega-3 enriched eggs, flax seeds, flaxseed oils, walnuts, soya beans. So all these are other omega-3 fatty acids. And here we need to have some balanced ratio of omega-3 fatty acids as well as omega-6 fatty acids. So omega-6 fatty acids, actually, these are also unsaturated fatty acids. It helps in certain extent, but increase in the concentration of omega-6 and decrease in the concentration of omega-3s. If there is an imbalance of these omega-3 and omega-6, again, there might be chances of inflammation because of the increased concentration of omega-6. So in general, omega-6 it is very good, but excess of omega-6 and imbalance of these omega-3 and 6, it may leads to inflammation. So we have to balance that. We have to take more amount of omega-3 fatty acids. We have to make the a balanced ratio of omega-3 and omega-6. Other important thing what they have noticed is there might, because of the depletion in the nutrition, there is a deficiency of vitamin D in most of the persons suffering from IBD. So taking vitamin D supplements, it helps in regulation of immune system, and it plays a vital role in the pathogenesis of IBD. The most common sources you can see fatty fish like tuna, mackerel, and salmon. These are also same. It contains omega-3 fatty acids, as well as it has a rich source of vitamin D. And some foods which are fortified with vitamin D, like some dairy products, orange juice, soya milk, and cereals, beef liver, cheese, egg yolks. All of these are some of the rich sources of vitamin D. And there are, again, there are some contraindications in taking vitamin D. Definitely, there is a deficiency of vitamin D, but when you take supplements, there might be imbalances of interleukins, because different sources of vitamin D, it has different interleukins, and some of the interleukins, it may increase the inflammation, and some they may decrease the inflammation. So we need to check out for these important interleukins before taking any vitamin D sources. We need to check what are the important interleukins which are found in these food sources, and accordingly we can balance our vitamin D sources and balance the interleukins. Next, regarding the herbal drugs, we have several herbal drugs which might which might be helpful in reducing the inflammation. As I told you that mostly the natural sources, we have flavonoids, we have antioxidants, and we have some anti-inflammatory properties in several plants and fruits. The most common evidence-based plant we have found in the literature is aloe vera. So it has significant anti-inflammatory effects. So use of herbal preparation of aloe vera, it has significantly reduced the anti-inflammatory effects. And the leaves of the plant, Generally, it contains abundance of phytochemical substances like polymenas, C-glycosides, anthrones, anthraquinones, lectins, so which are very much useful in reducing the inflammation. And there are several clinical trials have been done. In one of the literature, it has mentioned that there are about 44 clinical trials which is done on outpatients, and they have seen success rates in remission of IBD. And next is about the Triticum aestivum. So it is generally called as wheat grass, and wheat grass drink, which contains chlorophyll, amino acids, vitamins, and various enzymes. It has given a promising result in reducing the inflammation and having remission for IBD. Another plant is the Andrographis paniculata. So it belongs to Acanthaceaceae family. So, and it is very commonly grown in India and Sri Lanka. And again, there are several randomized clinical trials on human trials are there with the use of this Andrographis paniculata. It has certain anti-inflammatory properties, and which can have some remission for the IBD. Other plant is about the Boswellia serrata. So this belongs to the trees producing resins, which is well known for good smelling. And initial clinical trials, it has suggested that resin could be effective in IBD. And even in certain European countries, they have some nutraceuticals. They have extracted certain resins, gum resins from Boswellia serrata. It is, and they are using as a nutraceuticals in IBD. So other plant is about the tormentil extracts. So there are different extracts like Tormentilla erecta or Potentilla erecta. So these are the different extracts. Again, the combination of these extracts has given promising results in IBD. And the plants which are rich in anthocyanin, especially the bilberry preparations, so it has shown to have a good antioxidant activity and anti-inflammatory effects in IBD patients. Other well-known substance, the household product we can say is about the curcumin. Curcumin, which is a biologically active phytochemical substance, which has abundant of antioxidant, anti-inflammatory property, anti-carcinogenic activity, hypocholesterolemic activity, antibacterial activity, wound healing activity, anti-spasmodic activity, anticoagulant, can be used as anticoagulant, anti-tumor, hepatoprotective. There are several advantages of use of curcumin, and it inhibits many cytokine pathways, including interleukin 6, which is mainly it increases the inflammation. So it will inhibit those cytokine pathways, and it has various favorable safety profile for the use of curcumin. You can have in the form of curcumin drink along. You can take along with the milk, and there are some tablets where they have the curcumin extracts. So it has given a very good results for IBD. Another plant is about the Plantago ovata. So the juice derived from these plants or from these leaves, plant leaves, it has been used in the treatment of peptic ulcer and pain. And again, it has reduces the inflammation, and it has given a good results. Another plant is Oenothera benins. So it belongs to a group of Oenothera, which can be found in North America, but it can be available in throughout the world. Most commonly, it is called as primrose oil, evening primrose oil. It is the main product of the plant. And the main constituent of this plant is alpha linoleic acid, which helps a lot for the soothing of colon. And there are certain commercial available herbal products, like they have mixed certain extracts of myrrh, extract of chamomile flowers, coffee charcoal. So all it has given some promising results. And this herbal mixture, it has certain anti-inflammatory and anti-diarrheal properties. Even Artemisia plant, it has traditionally used for various digestive disorders, and same within IBD, it has given promising results. Let's discuss about some nutraceuticals like eupatilin. There are many plants which contains eupatilin. We can have the combination of these eupatilin plants containing eupatilin, and even there are commercially available tablets, nutraceuticals. They have extracted from the plants, and it has a proven efficacy in treating IBD. And next is polyphenols. Again, these are available abundantly in most of the fruits. So you can take fruits, or you can take certain as a supplements, which has given good antioxidant and anti-inflammatory properties. And phosphatidyl choline, choline has also there are natural sources. And if your food is not enough with these substances, you can have some supplements. Commercially available supplements can be taken in the treatment of IBD. And next, I'd like to discuss about some food and diet approaches which helps in reducing the inflammation or controlling the diarrhea for the patient, and controlling the immune system. So mostly the productive role is by birth. If you have breastfeeding, definitely those persons are having reduced risk of IBD. As I told you that this is the first step, and in the animation I have shown you that childhood infections generally they have the high risk of developing IBD in the young ages. So breastfeeding people, those who had breastfeeding, they are reduced risk of IBD. And taking balanced fiber intake, it also helps a lot. And here again, mostly people, they take high fiber content. But in IBD, we need to have a balanced fiber intake. Excessive fiber also, it may lead to certain problems. It gives more stress for the colon, and it may increase the inflammation. So it is better to have, especially in IBD, in general, you can take a good fiber intake, but in IBD, the people having IBD, whether it is mild or severe, they need to balance the fiber intake. They need to reduce the processed foods. They have to take unprocessed foods. Better to take the fresh fruits, vegetables, well cooked foods. So and having balanced nutrition, it gives a protective role for the intestinal mucosa. Other side, the increasing risk is ultra processed foods, high fat animal food, high cholesterol intake, high sucrose contents, western foods like fast foods. It may increase the risk of IBD, and it may affect the intestinal mucosa. So this is about the food and diet. Let me show you some important food and diets or vegetables. You can see that better to have good green beans, carrots, which is rich in antioxidants. You can take mashed potatoes without skin, which has a soothing effect. You can take asparagus. You can have some squash berries. These are some of the important vegetables. Although we have many vegetables which can be taken in IBD conditions, but it should be properly cooked. Make sure that it is properly cooked. And most important fruits we have seen in IBD is peeled apples, ripe bananas, cantaloupe, watermelon. It has given very good effect in IBD patients. Some of the proteins we can take, like, although we have to reduce the meat contents, but still some people, they cannot survive without meat. That they are very much prone to have meat. They cannot have like a single meal without meats. So in such condition, they can take poultry meal, avoid red meat. They can take poultry meal, try to take some salmon fish or other fishes, well cooked eggs, tofu. It can be used, which is rich in proteins. And of course, we need to reduce the contents of proteins. Excess of proteins, again, it may results in inflammation. And you can have some smooth nut and seed butters, which includes peanut butter, almond, and sunflower seed oil. These are some of the substances which are rich in proteins. And regarding eating habits, we need to change our lifestyle. We need to change our eating habits, like drinking slowly and avoiding using the straws, eating 4 to 6 small meals per day, staying hydrated, drinking a lot of fluids. And keeping a food journal to track foods that may cause the worsening symptoms. You can decide that sometimes we are very much we will be craving for having Western foods, and the foods which may affect. We know that it will affect our body, but still we like to take those kind of food. So it is better to have a track of those foods which may cause the worsening symptoms. And cooking food using simple methods such as grilling, steaming, boiling, and poaching. These are some of the important tips for eating, especially boiling and steaming. It helps a lot. And that too, it should be completely boiled and completely cooked food when you're using steaming and boiling, because sometimes there are chances that when you use steaming or grilling, there might be certain uncooked content inside the meats. So we have to avoid those things. It should not increase the stress on digestive activity of our body. So these are about some eating habits. We can change our lifestyle. And there are some dietary approaches like specific carbohydrate diet, which includes the removal of the grains, which includes wheat, barley, corn, and rice, removal of the sugars, and you can replace with certain honey, pure honey. You can have some yogurts, so it can be used, and you can have a good specific carbohydrate diet. And especially for the IBD patients, they can have gluten-free diet by eliminating all gluten, and they can take the gluten-free cereals, maize, buckwheat, millet, rice they can take, but it should be gluten-free. They can take meat, fish, fruits and vegetables, legumes, and dairy products. And we need to take certain low food map diet where we are reducing the carbohydrates, fats, oligosaccharides, disaccharides, monosaccharides, and related alcohols. So if we are reducing these short chain carbohydrates, definitely there might be some improvement in the IBD. An autoimmune diet, you can have some modified paleolithic diet, which excludes the gluten and dairy. So these are some of the evidence-based dietary approaches where when they are using these special recommended diet, it helped a lot for the IBD patients, both in Crohn's disease and ulcerative colitis. Apart from that, there are many parental nutritions are there. They can have some parental nutrition, appropriate balanced nutrition can be taken for these IBD patients. Finally, I'd like to conclude that natural remedies, food and diet, it plays a key role in the etiology and symptoms of IBD. And consuming plant-based foods instead of animal-derived foods, and taking whole grain foods instead of refined foods or processed foods, it helps a lot in IBD. And healthcare providers, they should be convinced to allow certain evidence-based natural products, appropriate dietary approaches, balanced nutrition among the patients to improve the conditions both in Crohn's disease and ulcerative colitis. So there is a need to bring an awareness among healthcare providers, because as of now, whenever we discuss with the doctors, they say, no, you should not take any alternative medicine, that they have to take these, there is a step-wise therapy. Of course, you can take that, but along with that, you can take some complementary medications. Now, even WHO, they have included these alternative medicine as integrative, that they have integrated in the mainstream medications. So you can take, you can find out what are the foods which harms, what are the foods which are giving some promising results, good results. Mostly we need some flavonoids, we need some anti-inflammatory food products or plant materials, that we need some polyphenols that which give some beneficial effect in these conditions. So by this, I will like to end the session. And I have seen very good proverb that, so diet is an essential key to all successive healing, but without a proper balanced diet, the effectiveness of herbal treatment is very limited. So you can take herbal treatment, but herbal treatment is for mild conditions. And apart from that, you need to have a balanced diet. There need to be certain food restrictions. You have to count your food, see that what food is good for our health. So there is another proverb which says that eat your food like a medicine. So whenever you see the food, you try to see that, okay, what gain we can have this food, that apart from filling the stomach, that what are the different medicinal properties this food you have. That so by this, I will end the session, and now it is open for Q&A.
Thank you, sir. Thank you so much for this informative talk. So we think we have a question from Amrita Thakur. It says that, sir, all plants have antioxidant properties. So can we use all of them in inflammatory disease, or we
As
have
I
to
told
go
you,
for any exception?
as I told you that nature is abundant of many anti-inflammatory properties and antioxidant properties. That, but as I told you, at the same time, of course, there are some beneficial effect for that. But we have to see that what are the interleukins which are available in these plants. That sometimes it may increase the inflammation. So we need to track that. We need to find out what are the important constituents are present in these plants and what are beneficial for these IBD. We need to keep a record on that. But of course, we can use all the plants which are safe in IBD. But if you find out that this plant, it contains certain substances which can increase the inflammation, then definitely we need to avoid it, because there are certain plants which are pro-inflammatory and there are certain plants which are anti-inflammatory. So along with the antioxidant activity, it has other chemicals, because it is a mixture of secondary metabolites and primary metabolites. Sometimes it may be harmful, sometimes it may be useful. So we need to keep a track of whatever the food or plants or fruits or vegetables we are using, keep a track of it, have a complete record of the important secondary metabolites in these food substances or plant materials.
Vijay Bhaskar sir has raised a hand. Sir, I'm making you to talk. Please ask the question, sir. Sir, you can unmute Vijay Bhaskar sir.
Hello.
Yes, sir, you are audible.
Yeah. Good afternoon, sir. How it is used for the polyphenolic compound for in diet? What are the advantages? Basically, that polyphenols are the basic in nature. How it is useful?
Polyphenols, there is evidence that even polyphenols, they have some useful substances. Let me see the literature. I'll let you know about these polyphenols. Just 1 second. Because whatever the information what I have collected, it is based on certain literatures, based on the evidence based. That mostly the grape extract, that it has found out that the grape extract, it contains certain anthocyanins, flavonoid glycosides, and hydroxycinnamonic acids, which gives the protective effect for ulcerative colitis. There is one study it has conducted in using these grape extract, which contains the polyphenols, and they have seen the good promising results for it.
Okay. Thank you.
Okay, welcome. Because I have selected based on the literatures, based on the so various evidence-based clinical trials which are done in humans. And they have some nutraceuticals. They have some nutraceuticals they have extracted from the plant materials, and they have brought many commercial products for these polyphenols.
Any other questions from the participants? So these were the two questions, sir. Okay, thank you so much, sir, for your valuable talk, and which is very interesting, and also you have shown us a very interesting video where we have seen how the innate immunity and the immunity works in the human body. That video is especially, it is going to be helpful for our BPharm students, where they can know about the how our body provides the immunity. And also, I think most of our BPharm students, by this, you will get to know what is the disadvantages of the junk food. Sir has told that it leads to Crohn's disease. And also, you have to be particular about your eating habits also. So thank you for also providing these details, sir. And being a pharmacognosist, I say that nature always surprises us, where we can see the isolated compounds from the natural products are going to have very good promising results, even though a very little amount, like negligible amount, shows the side effects, but mostly they are being useful for many of the therapeutic disease. And also these lead compounds also acts as a these isolated compounds acts as a lead molecules for new drug discovery. So with this, I thank you. I thank you once again for providing this interesting talk to us and letting us know how the diet also plays an important role in relieving this inflammatory disease. Finally, I thank everyone, all the participants who have joined us from the BU Pharmacy College, School of Pharmacy, Vishwakarma University. I thank you, all of you, and also our HOD sir, Makaran Puri sir, our VP sir, Gade sir, Vice President Jabade sir, and also the non-teaching staff of the BU family, BU admin, who has been without any technical glitches. We have smoothly conducted for providing with a very promising flyer. Okay, so I thank everyone. Thank you so much. Muruganandam sir, thank you so much, sir. We have Muruganandam sir also with us in the
Hello, sir.
participants.
Good to see you here
So
after a long time. It's almost 15 years.
yes, sir. Because of him, the corners seemed interesting.
Thank you, sir.
Yes,
Thanks for
thank
attending.
you, sir. Thank you for being with us. Thank you for being with us. Okay, thank you, everyone. Okay. Okay, sir. Let's conclude it. Okay. Thank you so much, sir. Once again, Beg, sir.
You're welcome.